This is a part 2 podcast on real gossip. With me, I have Jan Pinto. She is a nurse professional. Welcome to you, Miss Jan.
Thank you.
Okay, so let's move on to our question session on real gossip. My question for you is, can you give any bad or any odd experience in your nursing journey?
I'm so glad to be a nurse and be in the nursing profession for a long time now. Especially being at bedside is really not easy. I am so glad that I could impact the lives of patients and families whenever I have the opportunity to take care of them. Um, In my nursing career, I have got many DAISY nominations. That's a nomination they give over here for exceptional work that you do, where you go above and beyond your work uh, at your work. So I've got many DAISY nominations. Also, I've got an award in 2018 for contribution in nursing towards the patients and my colleagues for being involved in being a charge nurse, interim charge
Okay.
nurse,
Mm-hmm.
and also taking care of the new grads, their needs, precepting them, new to service, and also being a Cerner champion, like the I've been in Cerner documentation that's from paper charting to going into the computers to doing charting when you're doing nursing care,
Yeah,
also giving
so that's a
medication.
great achievement. It's a great
Yeah,
achievement.
I've been in that team for the longest, and I've also involved in teaching most of the staff from doing paper charting to charting on the computer. We use a program called Cerner application. So
Okay.
yeah, that's
So it's not that easy going from paper to online
yes.
because of the age difference, and you need a lot of. It's stressful sometimes. It's good to know that you've done a great job. So, any odd experience in your nursing journey?
Odd experiences. Since I work with a lot of demented patients, confused with Alzheimer's, and also a lot of stroke patients, I have got a lot of backlash dealing with delirious patients. Have They have hit me, scratched me, punched me
Oh,
many
that's
times.
not good. Mm-hmm.
Yeah, but I still think that that's part of their disease process, what they're going through. Also,
Yeah.
if you want, we can complain, but then
Mm-hmm.
we're just taking care of their health. So, and then I also uh, realize that it's not them, but what's going on with them, and so take care of them as much as I can.
Yeah, I understand that they do not know the insight of the disease. So sometimes we need to take it slow, and then once they come out of it, they will realize that what they have done sometimes is not that good. So it's good to know. So let's move on to the next question. How has your childhood influenced you in your journey? Any experiences?
Um, Studying in private school has helped me a lot, and also studying with you, my twin, like we were together from kindergarten to being a nurse, and we
Yeah.
also used to study together, discuss all, the question and answers, and then make sure, you know, you are progressing in uh, your school, college days and all that.
Yes, I do remember you were more brilliant than me and used to guide me sometimes.
Yeah.
Okay. So, any bad experiences in your childhood?
Uh, Not really. I think everything has to do with the uh, parents. They have guided us throughout the years, sending us to the private school, also grandparents who have taken care of us.
Yeah.
Yeah. And not really any bad experience. I'm very grateful to our family, friends, and all our relatives who have been uh, who have helped us throughout these years and being
Hmm.
very cooperative and being there for us.
Uh, let's move on. What do you think about robotics? What's the role of AI and robotics in healthcare?
Yeah, and nowadays everything is AI based and robotic most of the time. AI, like the artificial intelligence, is transforming healthcare, improving patient care, and streamlining workflow and advancing medical research. Also, there are many surgeries that are taking place through robotics. Like I've taken care of patients who have undergone different surgeries like laparoscopic gallbladder surgeries, hernia surgery, hysterectomy.
Okay.
It's less
Is it a
infections.
is
Yeah,
it a minimal invasive surgery?
yeah, it is minimally invasive, less infections, heals faster, less pain medications. It's more comfortable for patients. They're able to get up and walk and move around within 12 hours. And
But is it like expensive?
yeah, robotic surgeries are usually expensive.
Okay.
Also, from the surgeon point of view, they have lack of surgical touch, and
Mm-hmm.
but then it guides them in real time how to do that procedures.
Okay.
Reduces, it's very beneficial for patients because less of pain and prevents scarring and then healing really well.
Okay. Good to know about robotics. I think it's the main thing right now for the future. Um, so my next question is like you are a mother and got two teens. How do you cope up with them?
Dealing with teenage um, kids are not easy, and they always judge you for what you say. You truly have to listen to them and then
Mhm.
expect rejection from them. And then, but you have to go through, have rules and deal with their consequences.
Mhm.
So, example, if the teenager doesn't want to go for a social event, then you need to ask them what's bothering them, um, let them know it's necessary to connect with family and friends, and
Yes.
deal with social anxiety because nowadays everybody is on phone and watching reels and less into social, dealing with the uh, s- social, with family and friends.
Yes.
So you just have to encourage your teens. Also
Mm-hmm.
give them space and privacy. If they say, "Yeah, I have to do my homework," or "I have to um, get involved in uh, like the group chats with my friends," then just let them. So space and privacy is necessary.
Okay.
Also, yeah, listen to them, talk to them, and then accept them as they are, and then praise them for their good behavior, despite having lots of challenges, and
Yes.
seek
And also keep a
professional,
track of them, right? Keep
yeah,
a
keep a
track of
track
what
of
they're
them.
doing too.
Yeah,
Mm-hmm.
it's mostly nowadays in the social media era, there's a lot of depression, anxiety, mood swings. It impacts negatively. Also, they have peer pressure, and then they see other people, they're doing this and doing that, and why can't I do it? So also, if
Yes.
they have any problems, then seek professional help when needed.
Yes, right now there are a lot of issues going on related to psychological issues. So they need to get counseling sessions too. It's a good idea. Sometimes they don't open up to their parents, they open up to the counselor. So that's a good plan for the future too. So that you can avoid any risk, like some of them
Yeah.
they take poison, commit suicides, so this may help up for them. So it's a good discussion topic. So let's move on to the next question, the final one. Any message to younger generation from your side?
Yes, for the younger generation, it's very essential to do the job wherever you are. Try to focus on what you're doing. Stay on the current job as much as possible. Don't switch from jobs to jobs. Sometimes they feel, oh, okay, here it's not good, but it's good on the other job, but it's not always true. The
Okay.
grass is not greener wherever you go. So at work, I see like I've been in the same job for a long time now, almost 20 years. But I see that the new generation, they switch jobs. They hardly stay 3 to 6 months, but they move from job to job. But then,
Yes.
yeah, you just have to maintain that stability, so you also get good benefits wherever you are, and also lots of appreciation from your colleagues, and um, also deal like involve in teamwork that will help you. Not only you can help others, but others will help you as well.
Okay. So you have been working in a hospital. Like how long you have been working now in the same hospital?
Almost 20 years in, yeah, in the same
So it's
hospital.
a
Yeah.
good example for the youth and how we need to cope up with the work atmosphere and all that. You get a lot of benefits from that. This will help everybody. So
Yes.
thank you very much, Jan, for giving me your suggestion, your experience, and your knowledge, sharing your knowledge. Thank you so much. Have a great day, everyone. Bye bye. Real gossip every Saturday. Please do subscribe. Thank you.